Hi, I'm Dr. Moffat. We're going to take this dog's temperature. Maggie came in with a little cut on her foot. We were a little bit worried that she might have some kind of a bacterial infection. So we're going to check and see what her temperature is to rule in or rule out that particular disease. So what I've done is I have a rectal thermometer here, and I've dipped it in a little bit of KY jelly. And now we're going to insert it in the rectum for about 1.5 minutes. Hopefully she won't jump off the table. Okay, and just easily insert. Woo! I'm sorry. Okay, man. Well, the last try was a disaster, so I've got Michael's help now to hold Maggie's front end, and we're going to try to insert a thermometer into her back end here. So we've got the lubricated thermometer. We're going to do this for 1.5 minutes. You just raise your tail up, have some help if you need it. This is very important. Hold on. Hold on. Sometimes there will be a piece of feces right there at the back door of the anus, and so you want to kind of try to get around that because the feces is usually a couple degrees lower than their normal body temperature. And you want to be accurate about that. So if you call the vet in the middle of the night, it sure is helpful to have a temperature to tell them so that they know what to do and if they should come in the middle of the night or if you can wait and save some money the next morning. So, we've ruled out cancer. We haven't ruled out infection. We fixed the subluxation. Maybe that's all there is to it, but if that's the case, then you're going to have to readjust those bones a couple, 3 times a day for the next, week or so, because you want to train the bones to be staying back in the place where they're supposed to be. And she's being a good dog now that she's got somebody holding on to her. You want to read the thermometer as soon as it comes out. And sometimes they're a little bit trickier to read. You can also use a baby thermometer. If they have the little plastic wrapper on it, that's awfully nice. You want to lube that wrapper up. You can either use Vaseline or KY jelly, even just a little bit of butter, but you don't want to stick it back in there after you're done. Okay. Now we're going to read that thermometer. Good girl! You want to note what comes out on the thermometer, if there's any feces, what color it is, if it's black, if it's bloody, if it's sticky, and tell the vet that. And Maggie is at 101.8, which is totally normal. So I'm ruling out infection. If it is infection, it's very mild and we're right at the beginning of it. So what we're going to do is we're going to put a bandage on that, and I'm going to make a poultice. We're going to do 3 different poultices for you so that you understand how to do that.